too far.
No, yes, yes. You have to stop. Yes.
I'm not a pro, man. I'm not a pro. Look, I can do it so fast now. 1 second. If I may, Gene, if I may.
Thank you for the demonstration.
It's okay. It's okay. That was what the filming was for, really.
Jelly's been with Phil. Where are the other jellies?
I should do this for another 7 years, and then I can be the next presenter.
He needs to finish it.
That's on my anaesthetics every single time. Sorry, Al.
Sorry, I've got the training. No, it's not. It is a very good workshop. You're very
I can't write your surgical operation. You teach me. Stop bothering me.
I think there's someone doing it at home.
Do you want loaded or not loaded?
Yes.
You want loaded?
I want it loaded. It's not easier without loaded.
Stop touching, then you have everything. What happened to you and John Hopkins in the end? Are you guys doing that? He got here not with without any means. In terms of his demand, and he want the specs about your training and the money and all of that.
Bah, il fait non.
So,
It's going to be something really big.
C'est même quand ça fait comme ça que c'est bien. Il y a quoi?
Je vais avoir mon chapeau bas.
what has he told you?
Je vais présenter mon
Because I can't tell you anything unless you tell me more about it.
Demain, quand.
Non, je ne vais pas passer sur YouTube. Je dois représenter mon pays.
Hi.
Can you just say hello? Testing, 1, 2, 3.
In French.
Hello. 1, 2, 3, son.
Louder, louder.
Hello. 1, 2, 3, son.
That's perfect. Like that during this demonstration.
OK.
Yeah.
Je vais parler comme ça pendant la présentation.
You were so timid earlier when you were doing demonstration. I was like, this is not Linda. I'm like, where's the loud one that goes shopping and how people do not go and how this money exchange and blah blah blah. We have used for a lot in those 5, 6 hours.
So I can see the headset.
What you gotta do is
Go from left to right.
Yeah, okay.
So your left one you should be seeing.
Everything.
Ah, he's stolen on the challenge.
Yes. No, it's because they need to put some more.
Why?
And they put in an empty
He's very used to this. That
so
swing.
I got swing.
The swing. I want to know the swing.
no, but it's not
The pattern of the swing.
The other swing.
Yeah, the Polella swing.
Immediately
Polella swing.
at the window. Can you see that?
1 second. I can see you looking over someone's shoulder.
Do you want to try the whole
Yeah.
Yeah.
I'll just put it out so you guys can
We're just moving that
and
vision
get
out.
used
It
to
needs
it.
to be bigger, smaller, left, right, up, down.
The image of you over Jack's shoulder, it's fine, but I guess I can't really see the actual demonstration with that one.
That will be something after Melbourne. He wants something from a convert.
Can I look also? Can I look?
Who is this? Oh,
Can
yeah,
I
yeah,
look?
of course. Yeah, yeah. It might be a bit blurry for you because I've programmed it to my eyes.
where are those images coming from?
Camera there,
Okay.
camera there, camera there, camera here.
So you have make a capture.
Yeah, exactly.
Good. Okay, that's me.
Okay, now have a look at the 360. It should be a little bit better image.
Yeah. Do you mind if I just use that just to double check? Thank you.
It's something. Oui. Même si c'est- Yes. C'est trop bien.
No, I'm not trying. It's dangerous.
It's dangerous.
I mean, like, you feel like you are in
Yes, you are inside.
So how are we looking for like
No, it's
overlays?
I haven't tried.
it's a real
like you are
innovations.
there. Yeah.
You like it?
Yes, definitively, I'm in.
I feel it's beautiful.
I think that I will sleep on that side.
Exactly.
Yes. VRiMS with the cask.
Yeah, all the look, the VR headset is supposed to be within the keeping of the head. You understand what I mean?
The problem is that in all these teams, I'm the most stable
No, which one?
member of those. Isn't that?
Qu'est-ce que tu veux dire par là?
I'm the most Raymond. I'm the most stable person of these teams.
Pardon? Beg your pardon?
So this is the body. This is the PTZ.
Okay, so we move it in a little bit too far. Okay, so left, bring you in.
Yeah.
Give me a few seconds.
Look, suddenly now she's alive. Animated, she's loud. But there's 40 people in the room. She's shy.
All the technical.
PTZ here, body here. PTZ, body.
Just tell me that again.
So, body here, you're moving down something. Okay.
Ça va non? Become an actress is very difficult.
After outer. So I've set up.
C'est toi qui.
So
I'm not good with
Oh, did you want to do phone out in French as well?
Yes.
Okay, let's do phone out then. And then we're gonna do upper limb. And then
Upper limb, how many are you doing for upper limb?
3, 4.
the four.
The 4.
So we can do them concurrently.
Yeah. Then you're very well drilled. And then your next one will be ESP. Then I lie back down, give you my back. And then what other one are you doing? Are you the adductor?
No, I'm not.
Joe, doing okay, fine. Do your lot, and then we do the tummies, and then we do the limbs. So, yeah.
So.
Have you decided if you're who's doing fascia?
Oh, fascia. He's supposed to be scanning, performing,
Yeah,
so it can't be the dummy.
I think it's better to have it in a series because then what we do is we cut every video down into an individual block. So that when you're saying to your trainees, right, look at this in a series, they can go through it in individual blocks rather than. I introduce yourself every time.
Which one?
They're not made to do what they
Yes, but they might just I want them to interscaling.
Tu as fait ça tout à l'heure.
If you have a long video, then if they are only interested in bits of it, they have to watch the entire thing.
Raymond, have you got your butterfly?
It's easy for them to find individual bits. So the only other final thing I'd say is when you're doing this, you've got to remember that this is the medical student. That's the medical student. So you need to, that's the view that you're going to have. Okay, we've got the cameras overlaid so you don't get to see the demonstrator. But if you imagine this is the medical student and you're going to be talking, so rather than talking that way, you're going to talk to them with the cameras 360 is a medical student.
You do front of neck access.
No, but that's like what they're going to do. So
So-
in front of neck access.
Yeah.
You want to be in that position there? I'm going to, if you're going to be in that position
That
there,
means that it's full do front and back access. That position. Full screen.
Yeah.
Full assistant.
Louis?
Great.
You, so you're ready.
Perfect. Brilliant. Well done. Yes. Come on then.
Have you got your petit problem? Pas problem.
Tu veux un assistant?
You know, what it is possible for us to do, Jan, is we can, you know, if it's all complex anatomy, we can actually put a feed of that screen on there as well. You know, for future iterations, we can put that in as one of the overlays. If you're doing a bronchoscopy or something like that, or more endoscopically invasive.
That was what I was thinking, but I still don't have Wi-Fi access, so I can't link my laptop onto
You
it.
don't need to switch to HDMI output.
No, but I need to get the butterfly,
Where should I put the shot?
the probe,
Yeah.
to my laptop.
Okay,
So what that feed into here?
To actually link the heat feed to
No, you
you.
don't. It's got a HDMI output. So we just put a cable straight into it.
Into my laptop.
No, here, look. This.
Oh, I'm so sorry. I didn't know.
HDMI out.
Okay, but what
So
I'm trying to say, my butterfly probe
Yeah.
needs to speak to my laptop,
Yeah.
but that needs to be via wireless because I need to.
Okay, but then we can connect. We
I
can.
didn't know this, but
We can connect your laptop as an input.
Okay, cool, no problem. Let's try.
You can connect to this
Right.
Wi-Fi.
Yeah, I promise.
I was surprised why is it
All you need to do
one
is put
side?
it as a
because I
second screen.
messed up
Yeah.
my phone.
Oh, okay, okay.
Yeah, it should be on two sides.
Okay.
This is my phone because this side's on.
Okay, pick one butterfly and then we can do it.
So I can. It's like.
I should pick another one because this might be running out of battery.
You run the image straight through the battery rather than just videoing it. Yeah,
But this one, he can focus the screen on this.
This is stuff. And it's free.
Dragging down here. This is correct position again. Okay.
Yeah, you're not allowed at all.
Okay. Position in front of the neck. So let's see if we've got a nice position here as well.
Checking the butterfly.
So I'm going to move the medical student around because the medical student's going to be looking here. That's not a great view. So when I'm not around, is the medical student the best view? Because actually that's not a brilliant view. You're probably just going to want to come around the side a little bit and then have a look at that angle like that. So always think, where do you want the medical student to stand? Not there, but they can stand anywhere here. You want to stand in a better position. And then you will talk to this camera as the medical student. I'll come around to this one. So camera position, are you happy with it? We've got a bit more space so you can see the demonstration.
This is a good angle, but I'm just trying to refine it because she's going to come from that side, so I'm going to zoom in slightly.
I'm going to
Is this not zoomed in on
cameras
face?
out a little bit, John, so that I know it's going to be wider. I'm going to move the positions a little bit so we can see a bit more of the demonstrator. Because at the moment you can't see the demonstrator. So I'm going to move it. Can I get in there a second?
Yes. Also, John, with this camera,
So all we're doing is moving position. So the left is coming in a little bit because that's a redundant space. The right is coming out a little bit. So
Il me rassure que je parle bien l'anatomie là en français. Ou mon ordinateur.
Just stand in your position again. I'm going to move the cameras around so we can see what you're doing. Okay, good. And then all they need to do is move that a little bit further north so that that's face. So they just have to look above your head, and then you can move that one in a little bit, and then we'll be ready. So left, and back, and then right, back. Just see what that looks like with your 360.
Yeah, one sec.
So if you want to give some instructions to the trainee to look at different views, you could, for example, say if you look at the camera on your left, it is showing the view from the front. If you look at the camera on your right, it is showing this view here. So for example,
There's a no video. That's a lag. That's going to disappear.
so this camera here, this view, so you can say on the camera in front, just above my head, is this camera overlay. So I can come right in. If you want to show really close anatomy, and just above my head you can see that view of the camera showing really clear view of the anatomy.
Okay.
I have to do that to say if you want to refine it a little bit.
Thank you.
Okay. So multi-chord was the last one, the sound check is done, sound is on.
So same, you can really get in close with this one.
Just tell me the multi-chord is on, when you're ready. Ready?
Okay, a bit closer. That's it.
Okay.
Everybody ready? 3, 2, 1, cut.
Je suis le docteur Chokam Lionel, médecin anesthésiste et réanimateur du Cameroun. Donc, nous allons faire une démonstration de la cricothyroïdotomie, encore appelée FONA par les anglo-saxons. Pour cela, nous avons besoin comme matériel d'une lame de bistouri, une sonde d'intubation et de la bougie. Nous allons débuter par repérer la membrane cricothyroïdienne qui est située entre le cartilage thyroïdien, encore appelé paume d'Adams, et le cartilage cricoïdien. Donc nous avons cet espace-là qui représente la membrane cricothyroïdienne et c'est notre zone de ponction. Donc chez un patient allongé, nous allons premièrement réaliser une hyperextension de la tête afin d'augmenter l'exposition de la membrane cricothyroïde. Ensuite, nous allons repérer la membrane cricothyroïdienne qui est située entre le cartilage thyroïdien et le cartilage cricoïdien que nous avons là. Avec la lame de bistouri, nous allons réaliser une incision verticale, puis faire une rotation de 90 degrés afin d'augmenter le site d'incision. Puis nous allons insérer la bougie en orientant vers la trachée. Après l'insertion de la bougie, nous allons retirer la lame de bistouri et insérer la sonde d'intubation. Après avoir inséré la sonde d'intubation, nous retirons la bougie et nous connectons la sonde d'intubation à une source d'oxygène, notamment notre ballon d'embu. Puis nous débutons la ventilation du patient. Ceci était une démonstration de la technique bougie, lame de bistouri, sonde d'intubation de cricothyroïdectomie. Je vous remercie. Ça va, non? Bon, je n'ai pas dit
What about being an assistant?
thyroïdotomie. Tomie. C'est tomie. Cricothyroïdotomie. Cricothyroïdotomie.
Que tu n'as pas corrigé à la fin.
Jean, I said upper limb with Arthur
Oui.
first, and then do what's the next one? ESD and the back. And then we're gonna do tap lock by Joel.
Incision avec la lame verticale. Rotation de 90 degrés de la lame.
I can't seem to get hold of any Wi-Fi. We might just have to put that on.
Avec la lame qui est incision verticale avec la lame en position verticale.
Dans quel sens? Gauche ou droite?
Il n'y a pas de sens. Voici l'alignement, non. C'est parce qu'ils ont seulement tourné la tête du corps.
Mais quand tu fais ton incision verticale, tu peux faire comme ça.
C'est phallocaudal, non. Ce n'est pas comme ça que c'est décrit. C'est décrit vertical dans la technique. Vertical, rotation de 90 degrés, lame en position horizontale.
Are you happy now?
Yes.
So Meghan Markle, how do you want me to sit?
Brilliant.
Thank you.
Amazing. You're a
For
natural
me too.
movie star.
Put the jacket together.
Right, who's demonstrating next?
Arthur, he's just doing a preliminary scan
Okay.
on you very quickly.
Okay.
Have I got a good anatomy? If I'm not good enough, use Jean. Sit up.
Live person.
She might be still with
I'm going to switch off.
You're going to do the scaly, did you say?
He will talk. He speaks English.
I'm just going to put this against your legs. Don't kick out for me. Don't kick yes yet.
I don't kick it.
So where are you doing? You're doing it here, are you? So the student will only be able to sit. Can you do on that side? So that way the student can actually see. Okay. Is that right? I'll just see if I can see from that view.
Yeah, you can take a photo of this.
If
All I do for
do you mind if I just pull your shirt down just a bit? Thank you.
Actually, it's alright.
Right, if I'm in this position,
They need a stool
I'm just
that
going to
I can sit.
move this so
Okay.
that if I was a student, I could see the ski in this
That's
perfect
better.
angle. Lovely.
A bit closer if you can. I don't know if you can.
Yeah, I can do. Yeah. So I'm going closer and closer and closer. Happy?
Bit more.
Happy?
Bit more.
Yeah.
As far as you can.
I'm at the bed.
That's it. Yeah.
Right, now for the zoom, I guess you're at a perfect angle there. I don't really know what that's doing, but I guess we can
Just need to reposition this.
Should I pick my hair up?
Are you going on the right hand side or the left?
I'm going to ask you to
Yeah.
hold the screen just on your
On my breast.
on your breast. So you can see by
But he's doing this side. Oh, facing that way. Hold on, hold on.
like this,
I will hold it.
and then I'll have the camera facing
That's
down.
alright.
Have one logistical problem. I need the screen.
That way, facing this way.
Yeah, that's fine. But if you hold it
Yeah.
like this and your hand like that,
Yeah.
then I'll have it this camera over your shoulder.
Ah, okay.
Also, you'll be able to hold it.
I have two hands. Oh,
Yeah.
Are you using the Wi-Fi by any chance?
Not that one. We've had to get our own because it's just not doing anything for us, I'm afraid. So
You throw away the needle.
the needle for the needle.
Don't worry, won't poke you. It's got the cover over it, isn't it?
Yeah, I should have.
Okay, yeah. Open any of those boxes. There should be a needle in there.
Where? These boxes here?
The caudal boxes.
Yeah.
okay.
Oh, great. That's fine.
You go back more because it's
Oh yeah, it's here.
the black
Found it.
circle.
He wants it here.
Circle. There shouldn't be one.
You can't get the angle. It's too
Oh, okay, it's too steep. Okay, so let me just change the camera position so it tilts in a bit more.
Okay.
Yeah.
turn your camera around so it's now not in the way? I might need to do it because your infrared isn't in the direct line. Tell me when to start.
So go left. Yeah, that's it. Keep going. Keep going, keep going, keep going, keep going, keep going, keep going, keep going.
Actually, but just watch yourself behind the...
Or at the back.
Watch your back.
You've got like a lead, there's a lead it can see. It's one of those leads.
Let me just position this, John, so that it's coming in, because we need to show that screen. That needs to get out of the way.
They will all see us using this gel.
The other option is that you just have it facing the other way, John.
Is my hair up
that
enough?
way,
Yeah,
and then I tip it down.
Yeah.
Like that.
You can take
You're
some.
doing in English first.
Yeah, only English.
Only English.
Yeah,
No other languages.
no other languages.
Okay.
Okay. Hope this goes well.
Oi.
Do you have gloves by any chance? Do I?
Yeah, we've got somebody there, don't worry.
Where?
On the corner. Yes.
Okay.
I need a door.
That's why it wasn't working then.
You can't dust it off?
I have.
Oh, you have? Okay.
Just clean gloves.
Are they clean gloves? Do you have other gloves?
Yeah, there's a box.
Tell me when to stop, John.
Ah, okay.
Keep going, keep going, keep going, keep going, keep going. Now zoom in.
Onto the screen.
Go right. Do you want the screen or the skin?
We want the screen.
I've got
That one is for the screen.
So, go right, go right. Go right, go right. Go right. Now, go up. You've lost your feed.
Oh, power's just gone.
Huh?
Is it plugged in?
It did,
No,
it did it before.
No, it just needs to, some of them needs a firm hand on it, so look at which one it is.
No video.
Some of them I tape them down.
Yeah, power's flashing.
Yeah, it's on now, it's on, it's on.
It's
Come back, it's come back.
maybe step on it.
You've already put the lubricating jelly on. Okay.
Yeah? I just want to do a quick scan before
before you
we start
Camera when you're
recording.
ready. Is that John?
Zoom in now. Keep zooming, keep zooming, keep zooming. Keep zooming.
Have I got good anatomy?
Keep
If
zooming.
not,
That's
genius.
perfect.
There?
Perfect, like that. Just keep it like that.
Okay.
Yeah,
Just
don't
give me
move
a
the screen now,
second.
yeah?
I can be your guy. What do you want me to do?
So,
Can you have it slightly flatter? Like this? Does this still work for you?
it does. Still works.
You're at the two edges of the screen. No. Yeah, yeah, yeah.
I can't see my own interface.
Camlink. So, move your camera a sec.
Yeah, sure. 1 second.
Have I got
So
my
you want to
traffic
get
light?
right in there.
Okay, that's that one.
Okay, but don't forget you don't want to obstruct
You
the
see the
screen.
front.
Someone, Camlink 4K
Yes.
is blocked
Oh, my
by
face
Yeah, I'll
good.
move that.
that camera, yeah.
Yeah.
Go, yeah, keep moving to the left. That's it.
Oh, good
That's
bunch
good,
of grapes.
that's good.
Okay.
Yeah, that's good.
Arthur?
Yeah, good bunch of grapes.
So you got to think: is that camera position angle there? Is this going to give any more information than that camera there? Probably not.
No.
What would be a better perspective is to see how the clinician is positioned to the patient, to the imaging, in a more general kind of approach. If you wanted to do that, it doesn't matter so much from a surgeon's perspective. Surgery and patient position is quite important. It's actually better to stand back a little bit and then come in a little bit so they can see the context of where the clinician needs to stand in relation to the patient.
Yeah.
And then come in at that angle. That's nice. It's different to that one. It adds a little bit, or perhaps even from there. We ready?
That's a good angle.
Not yet?
Happy, yeah. So, 1 sec. Remember to introduce yourself, yeah?
Okay,
And speak to the medical student as he's feeling.
Tell him the camera.
She's feeling
This is the
very
camera.
lonely.
okay.
Jean?
Traffic light, not so classic, but it's right there, right?
Oh.
Yeah.
Why am I not classic?
Sometimes you see two, sometimes you see three very loud ones, but It's okay.
That's a nice
Am I
demonstration.
very loud?
Articulate that. Traffic lights.
Yeah, tell the medical student that in the video.
Okay.
She's
Okay, are you ready?
Just give me a second. Okay. Then the last one will be here. Just making sure. Beautiful.
Thank you.
Yes, I will point. Okay, that's the subclavian artery over there. And we'll go that side.
Now you've done all the regional you need. All in one day.
Intraclavicular. And there's lung underneath it.
Say that loud, okay?
Loudly to your medical student.
Okay.
Do not puncture the lung.
I'm usually an anxious person and not video.
You're very good.
Just do
Should we
like
start?
You may not hear.
you're just teaching.
Okay.
Yeah, just teaching.
All right.
I'm not good, so I'm gonna stand here.
Yeah, stand by the camera. So you
Just stand right.
stand right there, then it will be there.
You're just speaking to G.
So I need to introduce myself every time.
Yeah.
Okay. Okay, let me just go through the points.
Let me know when you're ready. Tell us when you're ready.
Okay. Okay, I'm ready.
Okay, so I'm going to count you in.
Loud and
Okay,
clear,
3,
yeah?
2, 1, and then you go. Okay? Three, two, one, go.
Hello everyone, I'm Dr. Arthur Polela, Anaesthetist from Levi Mwanawasa Hospital, and also ambassador for the African Society of Regional Anesthesia. So today we're going to look at 4 blocks, and we'll start with the supraclavicular block. Preliminary, you have to make sure that it's a sterile environment, that your equipment is sorted out, and that your drugs are drawn to a specific specifications for the patients, bear in mind the maximum limits. For this block, you need a 50 millimeter needle and a linear probe with a depth of about 3 to 4 centimeters is adequate. Okay, so positioning is quite important. You need the patient to face to the contralateral side, and the shoulder should be as low as possible. And make sure that you explain to your patient what you're going to do. Okay, so you try and locate the middle third of the clavicle and put your probe. Make sure that the pointer is the same as the indicator on your screen, and make sure that your screen is right opposite you, so that you avoid straining your neck. So you put the probe right into just above the clavicle and look for the subclavian artery. And lateral to the artery is a classic appearance of the grape structure. Below the artery is the pleura and the first rib. You want to get it to a position where the first rib is above the artery, so that you avoid puncturing the vessels. So if your needle inadvertently goes too deep as unplanned, it at least hits the bone and not into the pleura. You want to curve your probe slightly towards the posterior aspect, so that the course of your needle is from posterior to anterior, and that way you're avoiding the clavicle. Because sometimes if you put your probe in this way, you have difficulties manipulating your needle with the acromial process of the clavicle. So you want to rotate your needle slightly posteriorly, so that you've got space to introduce your needle. And your needle can come through once you've identified it, something like that, and you aim for the corner pocket. So your needle will come in the midline, somewhere there will be the entry point, and your needle on the screen will appear as a white line, and you aim for the corner pocket. I like to deposit at least 60% of my local anesthetic in the corner pocket, and I'll leave some as I withdraw the needle in the other corner, which is more lateral. I found that that works for me for most of my patients. Thank you very much.
Very smooth.
Is that okay?
That was very good.
While we're all set up and it's all in place, did you want to do that in any other language at all?
I only speak one language that's commercially available.
Does anyone else want to do it in any other language? No? Okay.
I've just been speaking to the surgeons. They're very impressed with your delivery of this course. Very impressed.
Thank you very much.
Gone away with it.
Infraclav and supraclav?
So we'll go interscalene, then infraclavicular. All right.
So again, introduce yourself, speak to the medical student, describe your procedure.
Okay.
We can then tag that.
You're happy with the spin? It's slightly moved, I think.
It's okay. It's okay.
That's fine.
Fine, no
It's
problem.
okay. All right.
So, do you want to pick up your camera? Yeah.
Smile.
Yeah, it's doing good.
I've got less than 25% battery, but that's fine.
Okay, let me know when you're ready.
Now it's your turn. Let me
I
know when
even
you're
learned
ready.
something.
I learned something.
Point posteriorly so that your acromial joint is not in the way.
And then always point towards the rib so you don't go to a pleura. Yay! I would like you not to puncture my pleura, thank you.
Then see
Is it on camera?
tension pneumothorax growth. That'd be good for friends.
Yeah, have you got a cannula here?
I think
Thanks.
that's the match.
Yes, I have a green.
But that's too much. No?
Although I'm worried he's doing your left side. I always find the left.
Right.
If you have to go.
Ergonomics is better on that side, but yeah.
Right, is everybody ready?
Yeah.
We're going to go for the second take.
Interscaling block.
Yeah.
Interscaling now. Yeah.
Right, 3, 2, 1, go.
Hello everyone, I'm Dr. Arthur Polela from Levi Mwanawasa Hospital. I'm an anesthesiologist there. I'm also an ambassador for the African Society of Regional Anesthesia. Today we'll be looking at the interscaling block, very good for your shoulder surgery. So preliminaries are that the screen should be right opposite you. That's a very comfortable position to avoid your neck having too much neck movement. And you want a linear probe with a depth of about 3 to 4 centimeters. So I like to do, first of all, the position of the patient should be similar to the supraclavicular block. You want the patient facing to the opposite side, the contralateral side, and you want the shoulders to be as low as possible. So the patient should have their shoulders as low as possible. Then I like to start from the same way I start my supraclavicular block. I look for the grape structure and scan upwards, looking for the interscaling groove with the scaling anterior on the right and the medius to the lateral aspects. So let's have a look. So okay, there we have our artery, and to the lateral aspects of it, we have our brachioplexus in the form of a triangular, and most people would like to say grape-like structure. So from there, you scan upwards and look at keep the grapes on the center of the screen, and you see that they will fall in between the medial and anterior scaling muscles. So let's have a look as we scan upwards. As you see, the nerves are slowly condensing into the interscaling groove. Let's see if we can get it, the traffic lights sign. Sometimes difficult to appreciate. Okay, have to do that again. Some KY jelly. There you have it. Just a second. So you sometimes have to scan up and down. Sometimes it can, you may not get it at the first attempt. Okay, I think I have something there. You've got 3 structures this side, and that's called the classic traffic light sign. You've got the scalene medius to the lateral aspects, the scalene anterior to the medial aspects, and the classic traffic light sign. And you want your needle to come from lateral to medial, because you've got less structures coming from the lateral side compared to the medial side. So you bring your needle in this manner, and you see it coming from the lateral aspects of the screen towards the traffic light, and you deposit about 20 mils of your local anesthetic in that region. Thank you very much. Wow, I almost lost it for a while.
Oh, it's fine. Sorry?
Even the patient.
That's part of the real experience.
Yeah, trying to find it goes
Well,
scanning
they
up
will
and
cut
down.
it like you did it straight away anyway, so.
Okay. All right.
Okay.
Okay.
How many more have you got?
Infraclav and then
Infraclav,
and then ESP.
we have the
Oh, auxiliary and then
auxiliary.
ESP.
There are 5 blocks, so we've done 2.
All right, 3 more. Okay.
3 more.
And they're different. They're all in it. I am quite baggy. Yeah.
Okay, so we'll go for the infraclav.
Yep.
Try and hold it.
Is it worth maybe pulling your arm out?
Yeah, like this is okay.
Do you want me to pull down? No?
This is okay.
It's okay. I think we saw it last time. Okay. We've run out of KIG.
That's all right. Sure. Used to it. Yeah. Sure. Yeah.
So
Standard surgical thing.
you have to scoop it up and use.
Missed it.
Whose poor jacket is this?
It's Ray's jacket.
Who's very
Ray's jacket.
With each block, do we have to say the same stuff like equipment and
because when you're looking on the platform, you'll just select the one you want. So you have to.
Yeah. Watch this introductory one first. Got it.
Watch the supraclavicular. Moving on.
Understood. Okay, when you're ready.
All right, you guys ready?
Okay.
Okay. I'll count you in again. So 3, 2, 1, go.
Hello everyone, I'm Dr. Arthur Polela from Levi Mwanawasa Hospital, anesthesiologist there. I'm also an ambassador for the African Society of Regional Anesthesia. Today we're going to look at the infraclavicular block, a perfect block for forearm and hand surgery. You want your patient facing on the contralateral side. You want your screen directly opposite you, and for that you need a linear probe with a depth of about 3 to 5 centimeters. You also need a needle of length about 50 millimeters. So once the preliminary is done, that you've got your local anesthetic and you have cleaned the patient in a sterile manner, you can do a preliminary scan. The landmarks are such that it's in the fossa, infraclavicular fossa basically. That's where you put your probe with the pointer facing towards you so that your needle can come from the lateral aspects of the needle into your field of interest. So you just want to put your probe right in the infraclavicular fossa and look for the subclavian artery. Okay. In this case, we need to increase the depth a little bit and add a bit of gain. Okay. So you have a classic appearance of The pec major is the most superficial muscle, and deep to each of the pectoralis minor. And you have the subclavian artery, which is evident by a pulsating artery right below the pec minor. So you want to direct your needle underneath the artery, and as you deposit your local anesthetic, you see it push the artery upwards. You want to push your needle from in the middle of the probe so that you can see all the way through it. And once you introduce it, the needle will come from the lateral aspect of the screen, and you direct it underneath the artery. You deposit about 20 to 30 mils of your local anesthetic in that area, and you have good anesthetic effect. Thank you very much.
Now you want my arm up, yeah? And that way.
Yeah. Can you have some?
Yeah. Yeah.
Are we able to do just wipe some of the gel, or we'll use it? We can pick it up from the probe.
I just need that one up.
We're getting close to a maximum amount of local anesthetic.
Yes, we probably are.
Yeah. Okay, let's do this first.
You want to untangle?
You need to untangle it.
Yep.
Yeah.
Just put it with her head.
And then I'm going to go prone for ESP, so I'm having a good day.
I'll try and keep the iPad where it was.
Yep. Is it
Right
here?
Yeah, that's
Lower?
Fine, that's fine, yeah. That's
Okay. Good, I shaved.
Oh, I wish we didn't have to get rid of the other bottle.
For the greater good of tomorrow.
Yes, for the good. I've got some, I need to bring
No, it's okay. It's okay.
You got some jelly?
Yeah, in my, if it's not been burst in my luggage.
Oh.
Okay.
I was begging the poor jelly. Okay, we're ready.
Okay.
Do you want to pre-scan? Do you want to pre-scan first?
Sure. Let me just pre-scan. Practice.
I'm sure you'll be fine. I definitely have an axillary artery.
You say that?
Oh, yeah.
There.
Oh, that's a lot more superficial. I was looking at
Some
the
people are
board.
watching a live stream and they've just said, we're watching and the sound quality isn't great.
Sound quality.
Yeah.
Isn't
Where's
great.
the mic? The mic's... Okay.
Okay.
I've just got a random text saying I'm watching your live stream, the sound quality's not great. So.
Turn the sound up to what's the sound on?
Is anything happening?
Do we need
No,
to
that someone's clearly just
Can
logged
you,
onto
can
the
you
room.
talk to the mic? Can you talk?
Hello. How are you doing? 1, 2, 3, 4, 5, 6. Testing, testing.
Very intense.
It's 1, 2, 3, 4, 5. Testing, testing. Is that good?
If there's a delay, accept that.
Okay.
That's
I did put 0.4 in.
because no one should win.
I think it's okay. Do you want to should we switch mics to the other one?
Oh, hang on.
Well, I don't think any of us knew we were being watched.
I didn't know we were being watched. Is it live right now? Like
It is live right now.
Ah, okay. Hi everyone.
Hi everyone.
Sounds fine to me.
Yeah.
Sounds fine. Okay.
Fine, cool.
Just speak really clearly.
Okay.
I can hear my voice all the way from here,
And
but I've got a
project.
massive mouth.
Project.
No, Jack, you haven't. Thanks, guys.
You couldn't hear because your things were over your head. We all said that. Yeah.
Jack, I can change it. It'll take me out of VRiMS and come back in.
There's no point, right?
We can
Yeah.
do the whole-
I've just said to them, we're recording now, don't watch. Yes.
Just turn that around so it comes to here.
Who knew we were just what random people were watching?
There we go.
As long as it's not kind of very, doesn't matter.
Yeah. Just Jan.
Yeah, near dead, not dead.
At what point do we ask Dan to
Increasing
start
amounts of
getting
exposure.
dressed for the next procedure?
We'll have to bring on off
I've got my back for the next one. My God.
Once
I've
you've
got a
passed,
sports bra. Yeah, it's ESP, no?
Oh, okay.
I've got a sports bra on, so that's all right.
make sure we pass the watershed once you get some of the other
Yes. Okay, what's the next procedure? Introduce yourself to a medical student.
Ready? Okay, right, so if you come in a bit, Sohan.
Just to get Jean's face up the way, yeah. Sorry.
Forward a bit, Sohan.
Yeah.
Mind your feet on the wires.
Keep out of
wires.
focus.
Move your left foot.
Move my left foot.
Yeah, because you're on the wire.
Okay. Happy?
Now you've got the 360.
I've got the, yeah, exactly. Can I move back onto the wires?
1 second, 1 second. Could you free this for me?
Perfect.
You're on the lead though.
I am on the lead.
Okay.
1 second. Alright.
That's it.
Put it somewhere there.
What's that?
Okay. Come away from the 360 over the top of the iPad.
Yeah.
That's it. That's the one. That's the one.
Lovely.
Okay.
Yeah.
Yeah, we're ready to go. You guys ready? Yeah. So 3, 2, 1, go.
Hello everyone, I'm Dr. Arthur Polela from Levi Mwanawasa Hospital. I'm also an ambassador for the African Society of Regional Anesthesia. Today we will be looking at the axillary block. For this block, you will need the patient to face to the opposite side. You want that the arm is flexed upwards, and you need your screen to be directly opposite you, and you need a probe, a linear probe with a depth of about 5 centimeters. For this block, you may need a slightly longer needle, and something like 80 millimeters should do for this block. So you put your probe right above the crease in the axilla and look for the axillary artery. Okay, we got it first time. So the arrangement is such that the radial ulna and the median nerve are arranged around the axillary artery, and downwards from the axillary artery is the conjoint tendon that goes towards the radius, which appears as a shiny caved structure right at the bottom of your screen, that side. You also have to remember that the musculoskeletal is somewhere in the belly of the coracobrachialis muscle. So that will have to be anesthetized individually. So you've got 2 options. You could either introduce your needle from the anterior end or the posterior end. My preferred choice is the anterior end. So you try and keep your axillary artery initially at the center of the screen, and you introduce your needle in the anterior aspects, and you aim for around 6 o'clock, 9 o'clock, and around 12 o'clock of your axillary artery. Depositing about 5 mils in each location that's the most common location of your nerves. And as you withdraw your needle, remember to deposit some local, about 5 mils in the area of the musculoskeletal, which is somewhere in the belly of the coracobrachialis. Appears to be somewhere there. And with that, thank you very much.
Do you mind if you said musculoskeletal?
Musculocutaneous. I said musculoskeletal.
Yeah.
Battery for this. We've got a battery.
It ran out of power. We can do it again.
Do you want to do it again?
Up to you.
Musculocutaneous.
Yeah,
Musculocutaneous.
Yes.
Musculocutaneous.
Yeah.
Musculocutaneous. Okay. All right.
It's very smooth anyway.
Yeah. Okay.
You're very natural.
Do you want to do it again because we ran out of battery?
No, I got it just before. She said thank you.
Did you want to do it again?
We can do it again. I mean,
Up
that's
to you what you want to do. It's just a name of a nerve.
Which nerve?
musculoskeletal, musculocutaneous. It's supposed to be musculocutaneous.
Yeah.
I didn't even notice. Yeah.
We're listening. It's just not French. Just not French.
Learning.
And then it's ESP at the back. You haven't even scanned my ESP.
ESP, oof.
ESP on that model?
Sorry?
But you won't know the ergonomics, that's the problem. Which ESP number do you want to do? Top, please, not any.
Top.
Yeah,
Yeah, just below the scapula.
nice.
So I usually use the scapula. You've got the option of counting the ribs upwards, but I find it.
I just wonder if my bra's
Just the screen is fine, but the camera should be fine.
I've got a sports bra on. I've got a clasp on. Yeah, surely there's a man that can donate them non-brad.
Yeah.
Non-brad. Yes, exactly. We don't need to undo our bras.
Okay.
You can donate your ugly.
Yeah.
You are live streaming.
Oh, great.
Everyone wants to do some banter.
Behind the scenes.
Your ribs then.
Don't worry, we'll edit all of this out.
Can we have your back?
Can I back? Do you want to do this again, though?
You can, let's do this one again.
Musculoskeletal. I always say muscular. Musculocutaneous.
Probably want to,
Musculocutaneous.
because you're wearing a shirt, right? You probably, you will take a shirt off and you're happy with, yeah, it's fine.
Sort of here first.
Shirts off and trousers
Do
down.
you want me to do a towel or anything? So you're, hopefully you don't need to take that off.
Courtesy towel. Courtesy towel. Mate, my muscles are not good. When you said it wasn't really easy to find, I was like, what is happening? Yes.
No, because I noticed that I was too low to have found the traffic light sign. I barely just moved it, so it has to be at the level of the cricoid.
Good. You got enough juice.
Yeah, there's a 60% there.
And then it will be the trunks and then the lower limbs.
You're going to do trunks, are you?
Trunk block, i.e. here,
Yeah,
is what
yeah,
we
I know,
meant.
yeah.
But he's also going bottom down and top up. So,
How many blocks are there?
1, 2, 3, 4, 5, 6. And then the lumbar. I'm just thinking about lumbar. Are we still going to scan lumbar?
Lumbar for
No, not lumbar.
For the-
sonography.
posterior complex, anterior complex.
Oh, can you? What are the words that I need to say, or do you want to do it? I can
No.
Because I'll do parasagittal. Oh, we do that in a moment. What time? Oh, just my anatomy is not there, and my notes are not.
So like the spinal canal is a circular.
There you go. So you're about.
I can go all the way. I can go all the way.
So you're where you need it to be, yeah?
Yeah, brilliant.
Okay, so no further than that, yeah? Alright, you ready?
Not yet. Musculocutaneous. Please correct me in case I say.
Your iPad, can you push it further down a bit?
It's not I.
Yeah, that's good. That's good.
It's Samsung. You're fine.
So, can you get your camera ready?
Yeah.
Okay, I'm ready as far as I need to be. Are you? Okay, 3, 2, 1, go.
Hello everyone, I'm Dr. Arthur Polera from Levi Mwanawasa Hospital, an ambassador for the African Society of Regional Anesthesia. Today we're going to be looking at the axillary brachioplexus block. And for that, you need your patient to face on the contralateral side, and you need their hand to be flexed, abducted away from the trunk. You need your screen to be directly opposite you, and you need your a linear probe for that. You also need a setting of a depth of about 5 to 4 centimeters should be adequate. You need a needle of about 50 to 80 millimeters for most patients. So the position should be such that you should place your probe right at the crease in the axillary and look for a pulsating structure in there, which should be your axillary artery. So let's look for the axillary artery. Okay, there we have it. Okay, we seem to have gotten it. So the radial, medial, and ulnar nerve are arranged randomly in various arrangements. They are not always in fixed positions around the axilla. And you've got your musculocutaneous in the belly of the coracobrachialis. Sometimes difficult to see, but when you scan, appears as a whitish structure in the belly of the coracobrachialis. So that should be your musculocutaneous. So back to the axillary nerve, artery. You've got two options. You can either approach this block from the anterior aspect, and your needle will come from the left of your screen towards the center, or you can approach it from the posterior aspects. I prefer to approach my a needle from the anterior aspects. I think I find it easier in that way. So you place your local anesthetic in the 6 o'clock, around 9 o'clock, and 12 o'clock. And that should get most of your radial, ulnar, and median nerve. So once you make sure that your needle is in the middle of the probe, in that manner, and on the screen, it will come from the lateral aspects on the left side and will come this side. Try and target the areas I've mentioned. 6 at around 9 and 12 o'clock should do the trick. As you withdraw your needle, try and aim for the whitish structure in the belly of the coracobrachialis, which should be the musculocutaneous. So deposit 5 mils on each of those 3 positions, and 5 mils around the area of the musculoskeletal, and about a total of about 20 mils of your local anesthetic should give you good anesthesia for the forearm and the hand. And with that, I'll thank you for your close attention. Thank you.
Just the last one, but I think that's fine.
Okay.
Oh, your turn. Back off. Oh. Here we go.
Okay.
Have I got?
I'll let you put your stuff off camera.
Yeah, I'm not going to be in camera.
Don't want to get banned on YouTube for this.
There you go.
Thank you, that's fine.
It's okay? Okay. Awesome.
Are we done?
No, there's another 6 blocks.
6 blocks.
Another 6 blocks.
Keep going until the Wi-Fi runs out.
Come on.
How do you want me?
Line. Can this come down? Probably can.
Yes, we can move the jacket.
We are moving on to something else.
Alright, so if it's doing the back, here probably. Yeah.
Don't do your fingers.
Probably the back is going to be best taken here, but I'm going to see where his back is when he sits.
We're going out.
Alright, this is the couch. Should we give him a pillow or something so he's not head back? Should we give him a pillow? Is there a pillow?
So I need to stand on the side.
Okay, you position yourself and we'll work around you. So stand wherever you want to stand.
I will be.
Like this? Nothing like this?
Yeah.
I'd like you to be here, wouldn't I?
Yeah.
Then I'll see his.
So this
Yes,
is actually okay, I think, already.
Yes, this would be.
Okay.
This probably needs to move a bit to the left. Do you agree, John, or can you see it?
Where's it? Can you
So probably be roughly here, right?
Okay, somewhere there.
There.
Yeah.
Okay. So needs to go down slightly. Push it down slightly.
Yeah, 1 sec. Happy?
No, up, up, up. Now stop. That's it. Screw it in there.
Yeah, screwing.
And then PTZ needs to be changed.
Yeah, I'll do it. You just tell me where to go. You just stay and you tell me.
No,
Oh,
no,
as
no,
in-
no, let me.
Whew,
You
what a
use-
marathon.
If I can find it.
It's over here.
Kabali is cold.
That is cold.
Okay. The depth
Go
will.
out slightly, so be very, very careful with it. But just go out maybe like a few centimetres and I'll tell you when.
Yeah.
Keep going, keep going, keep going. Now you've got after, is it?
Yeah, after.
So you want to go round that way a bit.
Say that again?
Nothing else. That's
It's
just
just
me.
Okay.
Jean, you alright with your feet?
Oh, sorry.
No worries.
Alright, so let me move that now.
We're going to go straight to the rest from here then, aren't we? Because it's going to take a while to wrap up.
Whew.
I'm
I'm
sorry.
standing on booby traps, so I'll be careful not to move. But it's
You've got 7, I think. There you go.
When you step back, be careful, yeah?
The
Okay.
van's coming at
right.
Is it?
Yeah.
Right, so we've got an hour left.
Have we? Okay. We'll do what we can.
Okay, that's perfect. Can you just put your probe where you're putting the block in? Yeah, that's fine. That's fine. So Ham, I need you to come here careful, please.
Yeah, come in. I'm going to put this in between your legs. Don't move them.
I think you need to go around the other side of these. And then if you do the over the shoulder kind of shot, yeah,
That's fine. I'm sorry for being
So-
right behind you all the time.
where's
The screen is here. Ideally, it should be here, but we can work with this. You need to.
Can you hold it? Would that be okay?
Yeah.
I will in a moment when I've been away from the camera for a while.
Which camera is looking at this one?
I'll look at it.
I've got it in the PTZ.
I'll have you.
there,
Fine. Okay, cool.
But I need to.
Hopefully not too much of it.
Can you lower it slightly? Lower. 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 Lower.